This video shows the technique of an optic nerve sheath fenestration performed using the operating microscope, usually under general anesthesia. The conjunctiva is opened nasally for several clock hours. The medial rectus muscle is identified and isolated on a muscle hook and cleaned from its attachments to surrounding tissue. A suture is placed through the muscle near its insertion so that it can be disinserted from the globe and later reattached. Disinsertion of the medial rectus from the globe provides an opening to the optic nerve. Once the medial rectus muscle has been disinserted from the globe, a traction suture is placed through the superficial sclera at the medial rectus insertion site. The traction suture is now used to pull the eye laterally, and a spoon retractor is placed between the sclera and the medial rectus muscle to provide access to the medial aspect of the optic nerve. As the retractor is moved medially, a yellowish-white vascularized structure becomes visible. Although this structure looks like the optic nerve, it actually is the perineural fat pad and should not be confused with the nerve itself. Blunt-tipped dissectors are now used to open the perineural fat pad, taking care to avoid the blood vessels. As the fat is spread apart, the dural covering of the optic nerve is revealed. You can now see the difference between the yellowish fat and the whitish-gray dura of the nerve. Once adequate exposure of the optic nerve dura has been achieved, a small cupped forceps is used to elevate the dura away from the underlying nerve to reduce the risk of nerve damage, and a small scissors is used to make an opening in the optic nerve sheath. Normally the opening would be made in both the dura and the arachnoid at the same time. However, in this particular case, only the dura and not the underlying arachnoid has been opened. Thus, a second incision is made in the arachnoid, at which time a copious amount of clear cerebrospinal fluid escapes from the subarachnoid space. The incision is now opened further with scissors. Once an adequate opening has been made, the operation is concluded by removing the retractor, removing the traction suture, reattaching the medial rectus muscle, and closing the conjunctiva.